Wisconsin University Hospital Public Annual Meeting. My name is Jack Morris. I'm Chairman of the Board of the hospital. And on behalf of the Board of Directors, I thank you for joining us this evening. As you may know, the Department of Health requires all New Jersey hospitals to host public meetings like this one. When the Department of Health started this effort in 2008, it was an important step to increase transparency amongst all New Jersey hospitals. Today, you will learn more about our academic medical center's vast range of programs and capabilities, our plans for the future, and the progress we've made on our current expansion projects. You will also have a chance to ask questions about the information presented at the conclusion of tonight's program. Thank you for taking the time out of your busy schedule to join us and learn more about our academic medical center. Now, I'd like to turn the program over to our Chief Executive Officer, Bill Arnold, to share exciting news about our clinical leadership and provide an update about several ongoing building projects on our campus. Bill?
Thank you all. Thank you for being here. We're excited to have not only our board, so let me start by thanking our chair, an amazing person with a lot of passion for quality patient care. You hear his story and why he does this each and every day. It's special. And all the board members that are here. It's truly an honor to work with each and every one of you, and the help you give me, the team, and just the overall place is amazing to me. So thank you for that. And thank you for the community members that took the time out of your night. I'm sure you could be somewhere else, but to be here to help us spread the word. There's a lot of great things happening. So as we go through those, I hope you can share these with the community. I want to start with just some new leaders here. Last year we announced Alan Lee as he was promoted to president of RWJUH. And this year it's Dr. Chris Gilligan as our Chief Medical Officer and Quality Officer. Dr. Gilligan comes from Boston at the Brigham as our associate. He was their associate CMO, and he's joined us as our CMO. And it's quite amazing what he's picked up already, and just the work he's doing and the connections he's making, both locally with all of our leaders, as well as our frontline staff and our community. And he knows what great looks like coming from the Brigham. If you look up the Brigham, you'll see how they're rated, and it's nice to have someone here to help us get to the next level. The next one is Jean Musner, our VP of Human Resources. Jean comes with a vast amount of experience from the West Coast, although she's really an East Coaster. She was at Huntington Medical Center in Pasadena, California. Before that, she was with Kindred Health and various other jobs with 20 solid years of human resource leadership. So welcome to both of you. Moving on. So we talked a lot about building program last year, and I just want to point out a few superstars that we were able to attract and add to our team. First, Dr. Gross, our chairman of neurosurgery. He comes to us from Emory. He has hit the ground running. He is leading the program here as well as leading the program throughout the entire system. So he's giving New Jersey residents across the entire state an opportunity to be treated close to home and then to come to the greatest facility in the state for his services, which is here. Next is Dr. Lazaro. Dr. Lazaro comes from he was NYP, then Northwell. He's a thoracic surgeon. He's innovative. He's recognized not only throughout the country, but throughout the world. He continues to teach, whether it be locally, nationally, or worldwide. So truly a special add. And what I really like to point out with him is it's not just his surgical technique, which is so special. It's the fact that he gives back. So the fellows and the younger thoracic surgeons throughout the system are all trying to get access to his OR and to work with him in his innovation research. So I welcome him. Now, as I was meeting with him, I talked about a situation we had here with Advanced GI. So he quickly said, I know that the two you need to go after. And that was Dr. Trinity and Dr. Benias. So they have since joined us from Northwell. And within 1 week, they had OR days that exceeded 9 cases. That's unheard of. So again, nationally recognized. And what's special is if you look at the zip codes of all 4 of these folks, the cases they do, those patients are traveling great distances for their services. So I think it's very important just to and this is 4. I could go on and on. Many more have been added. And each one of these are recruiting for their specialty. So more to come. Then the school. Last year we talked about the school. I think there were some questions about whether it would open on time. Well, it did. Opened on time. It's one of our favorite investments as a health system. $55 million was spent to bring this school to reality without any taxpayer dollars. And quite frankly, what made it for me, it was a lot of planning and conversation. But when we went to the ribbon cutting, it was crystal clear that those students and those children were truly happy. And it was special, not only to see them outside during the remarks that the mayor and others were giving, but when we did the tour, to see them in the classrooms and the excitement. And when you look at the facilities, the athletic facilities and all those new buildings, it's a true improvement just down the street. Moving on to the ambulatory service pavilion. When I arrived just 3.5 years ago, the thing I recognized and the thing the board really had pressured all of us to consider is a new facility for clinical services. There's long wait times throughout the country for services, and that's something that's just not accepted here. So the health system, as well as the medical center, supported by the board, moved forward and said we need an ambulatory setting that's Class A, special, and something that will attract both physicians and patients from across the state and country. So this will be opening in the beginning of the year, 175 new rooms, additional 80 specialties will be added. So again, a real opportunity for destination medicine. Moving on, the Jack and Cheryl Morris Cancer Center. Now, I was remiss, I did not mention, I talked about our investment with the school, but our very own chair donated the land for that school, which was truly special. With that, he started to really focus on cancer care. And when he tells the story of standing outside at one point when his grandmother was sick with cancer, he said, I need to do more. He truly focused on what he could do, and this was an opportunity, not only in land donation, but financial donation and commitment to help this building become a reality. And for those of you who are in the building business, there's escalation costs that are just astronomical. So when you set a budget and you look at a timeline, things can continue to grow. You have to purchase the steel and all kinds of moments in that building where we need the help. And our very own chairman stepped forward and helped. And DevCo has managed this project on time, under budget, and just done. I've done a bunch of these in my career, not quite this size. To me, this has been seamless. So thank you to Chris Palladino and DevCo. And you see just what's added here: 84 infusion beds, 74 exam rooms. When I first got here, many, and still, people call and say, we're tight in that area. As a patient, they're tight. They're being treated in close quarters. There's a wait time. There's services that need to be provided from this side of the street over to the hospital, or vice versa to the CINJ. So to have this building is going to be a game changer for the state of New Jersey, a true freestanding inpatient facility. And the other thing I need to mention is there's 96 new beds in that building. So that clears 96 beds from this side of the street to that side of the street, and opens up more rooms to create some private room opportunity, and really deal with our capacity issues. This is the first hospital I've ever worked at, and I've been associated with at least 12 to 15 of them. First one that truly, you wake up in the morning, you know you're going to be full. So this will definitely help us, not only help cancer patients, not only help our communities, but also create throughput opportunity. And then, of course, the Health and Life Science Exchange. Each year we talk about the relationship with the medical school, and I'm truly proud and honored to work with Rutgers Medical School. The leadership there has been amazing. Our new president of medical staff, Dr. Nell Maloney Patel is a surgeon who works as faculty and now leading the medical staff here. It's truly special. Things that we hear about when we sit with physicians, whether they're our own physicians or recruits are, they need space for innovation. They need space for medical students. They need space for administrative functions. Well, that became a reality. And that's a partnership, not only with our health system, but a competitor health system, as well as the state and other folks from around the world that are taking part in this to make it a reality. And when we interview people and physicians, I will say that this is one of the things that comes up each and every time. I think of Dr. Gillian when we tried to get you to leave the Brigham. This was one of the things you brought up. I think of some of the others. I had one that was leaving Michigan. This is what they brought up. So many health systems around the country are struggling financially. We struggle. Nothing's easy, but we're investing in the facilities because we want to create the best possible environment for patients to be cared for and for physicians to care for those patients, and for our staff and frontline workers. So really exciting news there. So I'm going to stop there. I want to introduce Alan Lee, our president. He's here each and every day with a tremendous amount of experience and, quite frankly, a lot on his plate with all these projects going on. So congratulations to you, Alan, and please come forward.
Thank you, Bill. So good evening. It's great to see all of you at the annual public meeting, and we have a presentation that will complement what you've just seen that Bill shared with us. Where I'd like to begin is that we've launched some new language for the health system that rolled out earlier this year, beginning with our new mission statement. We're an academic health system partnering with our communities to build and sustain a healthier New Jersey. Along with that, we also have a new vision statement. RWJ Barnabas Health will be the premier healthcare destination, providing patient-centered, high-quality academic medicine in a compassionate and equitable manner, while delivering a best-in-class work experience to every member of the team. Courtney Vose, our CNO, says this best. She says, we want to be the best place to receive care, as well as the best place to deliver care. We have established 8 values, which really points to aspirationally, who do we want to be, and what are the behaviors and the values that will align around that. They are accountability, compassion, curiosity, empathy, excellence, kindness, respect, and teamwork. So this is a very busy slide, and I don't expect that you'll read everything that's on the slide. It gives you a sense about what's going on in our health system. Greater than 5,000 beds, more than 41,000 team members, not including our 9,000 physicians, with 1,600 medical residents and 5,500 volunteers. That volunteer workforce, if you will, is tremendous as an asset for us. Makes it possible for everything that we do. 26,000 births per year, 200,000 admissions, 725,000 emergency department visits, 7 million outpatient visits. I could go on and on, but that gives you a sense of the reach and the breadth of the work that we're doing. At the very core of all that we do is our commitment as an HRO, or high reliability organization, to continue to transform ourselves that way. There are 12 acute care hospitals, 4 children's hospitals, a freestanding behavioral health center, and we are continuing to enhance our outpatient service offerings. I do want to, before I move off this slide, we have been recognized as a top employer by Newsweek and Becker's Healthcare, and that's really tremendous for us, and nationally renowned in leading medical and health services. So when you think about where we're located throughout the state, these red dots give you a sense of those locations for each of our centers, and we serve more than 50% of the state's communities, and that for us is very, very significant. When you hear us speak about being the largest in the state of New Jersey, this gives you a sense of reach. So here in New Brunswick, if you will, I'll transition and talk about what's going on in New Brunswick. We're 628 beds. As Bill said, we'll add 96 beds to that in just about a year from now for the Morris Cancer Center. We are 1,594 in medical staff, 320 residents, 2,200 nurses, 5,204 team members in total. And then with our inpatient admissions, we're doing over 34,000, just actually under 35,000, and 312,000 plus outpatient visits. Our emergency department is always busy on any given day, and it is quite possible as we look at our trajectory this year that we will get to 100,000 emergency department visits and nearly 2,500 births. So our Bristol-Myers Squibb Children's Hospital, right outside of these windows, is really a hub of New Jersey's only pediatric academic medical campus. So what we house there is 105 dedicated beds for children. It's the only facility dedicated with its own adolescent unit, 14 beds dedicated as such. We have a level 2 pediatric trauma center, our pediatric emergency department, our pediatric operating rooms, our ECMO program, which is one of only 2 in the state, and it's New Jersey's largest child life program, which we get recognized for very, very often. I do want to point out 2 banners that we're incredibly proud of for the 2023 and 2024 year. We have been ranked by U.S. News and World Reports as the best children's hospital in orthopedics and in urology. This work could not be done without the extraordinary partnership that we enjoy, as you heard from Bill, with our medical school partners. So when we think about the work at Rutgers Health, or Robert Wood Johnson Medical School, under the leadership of Dean Amy Murtha, and the work of our Rutgers Health, or Rutgers Cancer Institute, under the leadership of Dr. Stephen Labuti, we are positioned to do extraordinary things clinically and otherwise here. We have our flagship location of the Rutgers Cancer Institute right here. These collaborations with Rutgers not only are clinical in nature, but it's also biomedical engineering, and of course the business schools as well. And we have an extraordinary funding partner in the Rutgers Helix building for biomedical research that Bill spoke about earlier. So we are incredibly proud and celebrate excellence as often as we can. We want to make sure that our workforce feel that same pride, and quite frankly, the communities that we serve feel the pride that we have. I'll highlight a few of the awards and certifications, not all of the ones on this page, but a few of those, as I talked about both the orthopedics and urology for our children's hospital with U.S. News and World Reports, Bariatric Surgery Excellence Award by Health Grades. This one's extraordinary. Our program for bariatrics is one of the leading programs in the entire nation. And Newsweek ranked us as America's best ambulatory surgery, one of the best ambulatory surgery centers for 2024. I would be remiss if I didn't call out that we are high performing by U.S. News in maternity. And with a joint commission, we have been certified with excellence in several areas, including hip and knee replacement, bariatrics, spine, advanced comprehensive stroke center, and LVAD programs. And then a couple of others, I would be incredibly irresponsible if I did not recognize and honor the great work that our nurses do here. Nursing has been the most trusted profession in the United States. I've learned this from one of our board members, Dr. Reinhardt, for 22 years now. And we are incredibly fortunate that we have had 6 designations, and we are going for the 7th soon, as a magnet nursing hospital. And that is one of only 7 in the nation with that many designations. And then finally on this page, our LGBTQ plus healthcare equality leader award that we received recently for really focusing on the care within the LGBTQ plus communities. Serving the state of New Jersey as a destination for patients from all 21 counties in New Jersey, and this is a sense of how they get here often as a trauma center. Multiple times per day we watch and hear the landing of the helicopter on our helipad, bringing patients who are critically in need of care to our hospital. It's one of only 3 state-designated level 1 trauma centers in the state, The other two are Cooper and Hackensack. And it's the first designated pediatric trauma center in New Jersey as a level 2. And we are a leader in statewide emergency preparedness. When I say that, what I mean is that the Department of Health and the Governor's Office, when there are major situations going on, will reach out to this facility, given the clinical acumen and strength that we have here, to have us lead how the state responds to things such as Ebola and certainly the COVID-19 pandemic. So our goal is to ensure that there is a push for excellence at all times in all of our service lines. These are some of the key areas that we focus in, whether it's cardiovascular services, cancer care, children's health, neurosciences, which is both neurology and neurosurgery, women's health, GI and GI surgery, and you heard Bill speak about some of our recruits to lead that work, bariatric surgery, trauma, heart, kidney, and pancreas transplants, and of course care for the LGBTQ plus health services. Inpatient admissions. So you will see in this slide that in 2020 there was a softening. That softening is reflected throughout the entire country. Every hospital intentionally softened their volume so that they could create, for the first wave of the pandemic, space for care of primarily COVID-positive patients. And so every hospital saw some softening of the volume, and you did that because we postponed elective surgeries. You will see in every year subsequent to that, the volume has continued to grow, leading us to 2023, where we were at 34,649 admissions. A similar story with our emergency department visits, where you saw some softening in 2020 and growth subsequent to that. And we, as I said earlier, would not be surprised if in 2024 we exceed 100,000 ED visits. Our foundation, I typically like to describe our foundation as a collective group of angels that make all of what we do possible. So they work to really support the philanthropic giving, if you will, to this institution to ensure that we can do the things that are possible for our workforce, for the communities that we serve, to advance technology. Among those things, this past year, they raised $13.3 million for RWJUH, as well as for the Bristol-Myers Squibb Children's Hospital. They distributed $22.7 million to directly support the hospital's capital campaigns, as well as programmatic needs. And we celebrate the transformative investment that you heard Bill speak about in the upcoming opening of the Jack and Cheryl Morris Cancer Center, which will absolutely reposition the way that care is delivered in cancer, not only in this state, but quite frankly, it will be a model that will be looked at from a national and frankly an international perspective. They've provided funding for over 60 nurses and CCTs from an education and development perspective, and that goes for either continuing education or scholarship as well. And then also they raised $100,000, and I want to speak about this just briefly. When Bill Arnold got here 3.5 years ago, one of the things that Bill is known for is his incredible connection to our workforce. And he's been very intentional in terms of visibility. And one of the things that Bill has made clear to the entire senior leadership team is that there are certain things that simply cannot happen on our watch. In Bill's first year here, he learned of a story of a member of our support services team that had fallen on hard times and was not living in his own home. And frankly, there was a period of time where he was living out of his car and coming to work every day. And then the more that we learned that there are other stories of tragic situations like that. And so we reached out to our foundation board, who happily stood up and started to collect funds to figure out when we have a situation such as a fire where someone loses where they lived, didn't necessarily have insurance because it may have been a rental situation, how do we support them in those cases? And so many others. So $100,000 last year has supported our Employee Assistance Fund program, which frankly is also largely funded by our leadership team here as well as the foundation board. So I'll pause there and happy to take any questions before handing off to our own beloved Mariam Merced. Mariam.
Yeah, we have her.
It'll be another
first.
question.
And then
Sure.
so much for having me here tonight. It's always a pleasure to come and do this report of our community health initiative here at Robert Wood Johnson University Hospital. And before I start, I just want to recognize some of the members of the community that are here. The staff is here from Community Health. Jose Montes is the chair of our Community Relations Committee. Thank you, Jose, for being here and supporting us throughout the years. Our Community Health Ambassador volunteers are here. Ladies, if you want to get up and door-to-door canvassing, bringing information and resources to our community, and we're very happy to have them as part of our family. So I'll talk a little bit about the overview. As you know, our main goal is to provide access to preventive primary care services and health education for the communities that we serve in Middlesex County, with special emphasis on the identification of medically underserved populations through comprehensive community outreach and the creation of community-based programs and partnerships. As you know, as per the Affordable Care Act, every hospital needs to conduct a community health needs assessment and a community health improvement plan. In our case, we do it in conjunction with St. Peter's University Hospital, and we have Robert LaFolla that is here, that is our joint staff, that coordinates our community health improvement plan. The CHNA and the CHIP, as we call them, they identify health issues and concerns that impact the community, the barriers to accessing health care, strengths and opportunities for programming, personal health attitudes, conditions, and behaviors, and we prioritize those needs and develop action plans. We are currently on the 2023-2025 Community Health Needs Assessment. We did that through looking at secondary data, community surveys, focus group, develop goals and objectives based on those priority areas. We're currently conducting the community health survey, and when you came in, you saw a little sign. There's a QR code. If you haven't done that survey, please help us. We need to collect 1,500 of those surveys for our new community health needs assessment. In terms of health education, all our program is embedded in that community health improvement plan that it is mainly talking about mental health, access to care, and food insecurity and housing insecurity. So this is a list of our community health education and prevention programs. We host a number of maternal and child health education programs, meditation and relaxation programs to reduce stress in the community. We saw an increase in those issues in our CHIP around mental health. A lot of adult and health education programming, either online and in person. This is led by Dr. Karen Lynn from Family Medicine, that she brings her residents to be able to do those educational programs for our community. We do topics on adult immunization, nutrition classes, healthy cooking demonstrations at the fitness center, monthly fitness and wellness program, and a lot of special programs through the Heart Month and Cancer Awareness, Mother's Day, and Men's Health project. We're very happy to report that last year we worked with our nursing department to put together a conversational ESL program where they work with our community health ambassadors to improve their language skills, right? So they were trained by the Rutgers education department to conduct these conversational ESL programs, and they get together, they talk to them about a particular health area, and then the community health promoters have an opportunity to tell them about the different challenges that sometimes the community has in accessing services, and this information, the nurses can take it back to their department. We also have been hosting ESL classes for our frontline employees, and this is our graduation from last year. Our health promotion programs, we host the only Latino diabetes management program for over 60 diabetics and their families. We provide support, education, and also a lot of social support and assist them with medication. We have Project Inspire, which is a prevention project for youth, for them to live a healthy and active life. We provide, it's like a boot camp of resources and wellness programs for them. The kids get to cook and show their parents healthy ideas, and they, take pictures of the food and send it to our nutritionists to make sure that they're doing the right thing. We host a number of support groups at the fitness center for our patients. During the summer, there's a number of youth summer programming. I want to highlight the Autism Mentoring Against Racism, Drugs, and Violence as one of the programs that we use art as a way of communicating health information for our youth in the community. And like you saw, the Community Health Ambassadors is a training outreach program that is funded by Johnson & Johnson. These ladies act as like that bridge between the hospital and the community. They are also last year starting doing a very important program where they're working with faculty to identify minority communities to participate in research. We were able to work with Dr. Sunanda Gore to identify more than 300 children for a COVID youth research program that she's doing. In early detection, I want to highlight the work that we're doing at the family planning clinic that we're doing under the leadership of Dr. Glenn Marie Matthews, and she's been amazing in providing these services in the community. Last year, we were able to expand the clinic to 3 days. That more than double the amount of people we're seeing at the clinic. They offer a number of services from birth control to testing and treatment of STIs, pap smear. They have an amazing bilingual staff that serve uninsured and insured patients. We do the education and the outreach piece at the office. We're active in social media. We are doing risk reduction, pregnancy prevention, programming for youth in the community so they are aware of the services that we are providing at the family planning clinic. And of course, the community health ambassadors have been instrumental in going out door to door, different communities, telling people about the resources that we have at the clinic. You see the numbers for 2023. We're in 3 high schools doing education with young people, and we're planning to do more. Also around early detections and screenings, under Dr. Lynn, we are doing flu shots and health fair. There's more than 20 or 25 health fairs that we sponsor a year, and we target men and women and culture-specific group. With the health equity team, we did the Asian Health Fair a couple of weeks ago that was very well attended. We also provide flu clinics. We vaccinated over 500 kids last year and 100 adults. We continue to do COVID-19 outreach and education and vaccine clinics. It's a joint program that we have with St. Peter's where they provide the vaccine and we provide the outreach effort. We have a number of men's health fairs and annual cervical breast cancer screening. We work directly with our churches, our schools, and other community-based organizations. So we actually go to the community and provide the resources right there in the community, and we make sure that they are referred to the services that we have here at the hospital. The community health needs assessment also has embedded a number of social determinants of health that we found in the community. One of them is around violence in the community. For years here, we have done a number of initiatives around domestic violence, and we have created the first domestic violence awareness coalition in the city to increase awareness and reduce stigma around domestic violence. We do an annual march, and out of that work, in 2021, we developed the Hospital Violence Intervention Program, which is a program that we host together with the trauma department, where we provide trauma-informed wraparound care for victims of community violence. Since we started this program in 21, we have seen 507 victims, right? These are victims of gunshot wounds, stabbing, assault, and domestic violence. As you can see, most of the people that we see are black and brown men, and we provide a number of services from emotional support, housing assistant, food assistant, in a way of having these patients get their life back together. You know, here in the hospital, we can take care of their bodies and their wounds, but once you get out of the hospital, we need also for them to work with the trauma that that incident provoked, and also, I'm so sorry, and also provide assistance with some of those needs that they have. 20% of the women that we see are victims of domestic violence, and we co-serve them with our local domestic violence group here, agency that we have in town. A very important piece of this program is that not only we are doing the case management and the social services for them, but also we created a partnership with the Puerto Rican Action Board for them to provide counseling services for those patients. So for the ones that are set to go to counseling, which is a significant number, 87% experience a reduction of traumatic symptoms. Food insecurity, it was a need that we also, a social determinants of health that we have been working in this community in Perth Amboy for a while, that got aggravated through the pandemic. And with the assistance of corporate, we were able to bring some farmers to bring produce, fresh produce into the community during the pandemic, and we have continued to give out those fresh produce to families that have been identified as in need. We also work with our community-based organizations, with our schools, to make sure that we identify those families. We distributed over 235 boxes last year. That was like 12,000 pounds of food. We work very close with one of our food pantries in the city to provide emergency food services through the Sudan Street Reformed Church. They serve over 1,500 residents. Our community health ambassadors go there and assist with the distribution of food every month. And we also have a program where we volunteer to assist them in planting a vegetable garden, and all the produce that gets produced in their garden goes back into that food pantry. We're happy to report that last year in February, we opened our own maternal wellness food pantry at the soup kitchen. We started with 10 women. Now we're up to 40 women. We do referrals for support and social services, blood pressure screening with the Rutgers School of Nursing, and we are now, our goal this year is to increase to 20 additional pregnant and postpartum individuals, as we have some renovations done in the fitness center, and we'll have more refrigeration and shelving. This is another great program. As we looked at the availability of employment for our young people in the community, we partnered with the Youth Advocate Program, DEPCO, and the Gingoni Construction Company, and Middlesex County College to provide a healthcare hospitality training under the leadership of our VP, Odette Periel. She put together this amazing program that we supported her. It's an 8-week summer program that included healthcare and employment skills training and rotation through several departments in the hospital. We provided stipends, mentorship, and employment opportunities. We had an initial group of 15 students, 4 of them already working here. The idea this year is that we're going to expand to 25 students and expand the number of departments that they are going to be rotating through. During the pandemic also, we saw one of those issues of technology gap within vulnerable communities, and I'm happy to report that we're working with Dr. Sabiha Hussein, and this is her brainchild, her Your Health Kiosk, which is a digital tech platform to educate and navigate patients that have issues with access to care. So they give access to health information, screenings, primary care appointments, health research initiatives, and social services. This is done by connecting the patients with community health specialists and navigators. Last year, they connected more than 430 patients in 2023. We continue to be very active in social media. Our Susalu Facebook page had more than 66,000 hits, 800 followers. We do Facebook Live, videos, online training. And we're also working with the East Brunswick Library. They've been our partner for a number of years in a number of health literacy videos that we're sharing with all the libraries in the county. And I always want to close this presentation by saying that we have an amazing staff here that not only help us with all the programming that we do and the education and the screenings, but they also give from themselves. They give time, they give money. And I was making this list, and this list is becoming longer and longer. I'm going to have to go to a second slide if I want to put pictures. But they've been very active with us in giving back to school supplies for students in Franklin, in New Brunswick, book donations, and I'm happy to report that we have some donations from a local bank to create these small libraries that we're going to be placing in different locations around the city to promote reading with students and adults. We had donations for the homeless that we collect from the employees. So our police officers, when they call us and they say, we need boots, we need gloves, we need things to help our homeless population, we are there to support. Last year, we donated more than 400 turkeys. Adopt a Family continues to be a very busy program that we do during the holidays, where we identify families in high need through different community-based organizations, and the employees go above and beyond to make a nice holiday for these families. We do one of the best holiday celebration for kids in the community, like 900 kids show up and everybody gets a wrapped toy and photos with Santa. And a lot of those toys come from here, come from donations from the community. We have done a lot of donations for hygiene items for that maternal wellness pantry. We started doing now a lot of community service day, doing different hospital celebration weeks. Prom dresses is another program we started a number of years ago. Only this year we collected 120 dresses that we donate to an organization called Hope that gives out prom dresses to students in the surrounding communities. We're also doing Martin Luther King Reading Service Day at our local daycares that our hospital employees go out and read to our children. This concludes my report, and thank you so much for having me.
Marian, that was unbelievable. The work you're doing is just amazing. Okay, we're now here for questions. Go ahead, Charlie.
Good evening, Charlie Cradaville, New Brunswick Today. I have a few items to ask about, but first just want to say thank you for the great presentations, everyone. Appreciate them and learned a lot. One thing I didn't hear mentioned was the nurses going on strike for several months. I would ask you to reflect on the strike, and if you could say if there's any lessons from it or costs that were incurred, and just be curious on your perspective now on the other side of it.
Yeah, Charlie, we don't really talk about it that often because we had such a nice re-entry. Nobody wins in a strike, right? That wasn't easy on us. It wasn't easy on the nurses or anyone involved. So as we re-enter, we've really done everything we can. You heard Alan point out the magnet recognitions, and we're just moving forward in a positive way. It's been really, to me, a great giant step forward. We all learned something from it. We definitely needed to get closer, and we are. This team is on the floors each and every day. Jean Buser has just started. Her philosophy is she and her team need to be on the floors where the staff is so that they can learn as much as they possibly can before there's issues, so we can address issues before they become real frustrations. In terms of total expense, it's been in the news, so I feel comfortable. It was in the neighborhood of $150 million, something we definitely didn't need with all this expansion and construction happening, but frustrating, some learning, I think he has some learnings, relationships. We all need to have better relationships. And the other thing we have to keep in mind, and then I'll ask Alan if he has some input on this, is our nurses, our staff, everyone that works in this industry went through some really difficult times with COVID. They were challenged each and every day. Their families were at home and they were here caring for patients. On the front end, really putting themselves at risk. So, you know, that created a lot of stress. And as we came back from that, I think it got to a point that there was a release. And now hopefully we're back, and I believe we're back, and it's been nice. We got that.
I think Bill articulated it incredibly well. It really ultimately is about relationships. And when I say relationships, I don't mean that sort of broad. I mean in the moment. We have to make sure that our workforce in total feel that they are both valued and heard and listened to, and that there's not necessarily an answer of yes to everything that's requested, but there has to be that dialogue ongoing. I also really appreciate the point that Bill raised, because I think healthcare professionals across the United States and certainly globally who have survived the pandemic had not really an opportunity to sort of take time off since then and really do self-care. And when we don't, after that sort of trauma, and we can call it a trauma for those of us who have gone through it, I think some of it is resulted in what we just experienced. We are very forward-facing. Our results are showing, as Bill said, a very positive re-entry, keeping a focus on what excellence in care delivery and really making this place the best place for our workforce to both deliver and receive care.
Thanks. Just a few more questions. I know last year we spoke about the FTC nixing the St. Peter's deal, and now I understand Atlantic is making a move to join up and partner with them. Wanted to ask if that's something this board supports and what you think it means for the future of healthcare in New Brunswick.
Well, we really hoped to have that partnership. St. Peter's is very important to us, and I think we're very important to them, and we did our best together. It was amazing how the relationships developed, so it was a real letdown when it was not approved by the Trade Commission. We had, as I mentioned, we're at capacity here, so that was a real opportunity to have centers of excellence through our service line operating model at both locations. So it was a letdown. It was a letdown for Les Hirsch. It was a letdown for our team here, as well as Mark Mannigan and the assistant team. You know, in terms of the board supporting it, the board supported the transaction. The Trade Commission did not. Both the corporate board and local board now really support us in figuring out what's the best solution to continue to grow, given our capacity issues. And I think the investment that was made many years ago, I admire what this board did. And thank God they partnered with Somerset. I think Somerset gives us a lot of opportunity. Monmouth Medical moving services closer to the Parkway on Route 18, I think starts to connect the dots. And hopefully we can serve the highest level needs, because that's what we have here. We have the tertiary and quaternary services. So I believe we're positioned well with great board support and system support, and a strategic plan that's in the works to really address the issues. I don't know if you want to add anything. Okay. Thanks, Sean.
I know you talked about a lot of expansion projects, and wanted to ask about the parking situation. I know, the county's parking deck connected to the cancer center is starting to open. But do you see additional needs, additional parking projects? I know you mentioned you had some consultants you were working with. Can you identify them and what the status is of their work?
So it's done through the parking authority. So we don't make the direct contact or relationship with any of the folks that are doing the evaluation. We have some of our members that see the data, and we've given data. There will be a need for additional parking moving forward. Now it comes down to how do all the different folks that are working together. I mentioned Rutgers and other teams coming into this market. So how do we work together to solve that problem? I do believe there will be a need for an additional parking deck, and that's being looked at very closely. Kevin, I don't know if you want to add anything with your experience.
No, I think you answered it completely.
Okay. Thank you, Charlie.
Thanks. And, yeah, the last topic I wanted to address was the ambulance service, the ambulance situation here in New Brunswick. I know we had a tragedy, a fatal shooting in March, and there was a concern about the time it took for the victim to get care. And I don't have all the facts, but I certainly do notice that the Robert Wood Johnson Barnabas network has expanded to the point where a lot of other towns that used to be served by volunteer squads are now, getting services through RWJ. And I guess to that concern, I wanted to understand the mechanics of how that works versus the hospital board and the different entities that make up the Robert Wood Johnson network, and request kindly, if I could, through your office, a meeting with whoever's in charge of the ambulance stuff so that I could get some answers.
That would be me.
Okay.
Believe it or not. I mentioned the new operating model, and I appreciate the request for a meeting because it's hard to do this in sound bites, as you can imagine. There's a service line which includes emergency medicine as well as the ambulance service. We have a robust transfer center in Somerset, and we have our ambulances throughout the state, as do our competitors, right? Many of our competitors. And you mentioned the towns. The towns are all coming to us to bid on that service because they're having trouble getting volunteers, or they'd like to have us do it rather than them, just given that we're in the neighborhood anyway. So that's growing fast. There is a shortage of EMS staff across the nation, so that's something that we're all dealing with. I can say that we've made some healthy market adjustments, and we're having great success in our hiring and increasing the staff. In terms of the situation you bring up, though, that had nothing to do with staff or shortages. It's a crime scene, so we deal with whoever's in charge of that crime scene pulling us in to at the appropriate time. Remember, these are EMS workers. They're not armed. They're not police officers. So we have to do that in a safe way. So I'd look into that with you. I have no problem doing that.
Thank you.
I appreciate the question. It's a good one. It's a very good one.
Yeah, thanks. And I'll follow up after the meeting. Look forward to further discussion. Thank you.
Thanks, Charlie. Any other questions? Wow. All right, everyone went to sleep. Well, Alan and I appreciate all of your time, and Mary, thank you. It's amazing what's come together here, and having your support and you here to help us and bringing the community's views on us. Remember, that's important to us. You're out there. We want to hear what it is we can do better to serve our community. I think we learned tonight there's a lot happening, but there's a lot more that could happen. So we're all ears when it comes to advice. So thank you very much, and have a great night.
Terrific.